Hi there, my name is Shavinesh Deo. Today I will be talking about the pathophysiology of abdominal aortic aneurysm. Abdominal aortic aneurysm is a permanent local dilation or bulging of the abdominal aorta greater than 30 mm or exceeding by 50% the normal aortic diameter. The aorta is the largest blood vessel in the human body. It runs from the heart to the chest and to the abdomen, where it bifurcates into the iliac arteries in order to supply blood to the lower extremities. An aortic aneurysm can occur anywhere along the length of the aorta, but it mostly occurs in the abdominal aorta, and 95% of the time it occurs below the renal arteries. The walls of the aorta, when weakened, can swell and bulge, causing an abdominal aortic aneurysm. The weakness of the walls of aorta is mostly caused by arteriosclerosis, atherosclerosis, calcification, and chronic high blood pressure. There are 4 types of abdominal aortic aneurysm. The first one is saccular aneurysm. The second one is fusiform aneurysm. The third one is dissecting aneurysm, and the fourth one is false aneurysm. The saccular aneurysm is unilateral pouch-like bulge with a narrow neck, whereas the fusiform aneurysm is a spindle-shaped bulge encompassing the entire diameter of the vessel. The dissecting aneurysm is a hemorrhagic separation of the medial layer of the vessel wall, creating a false lumen. A false aneurysm is pulsating hematoma resulting from trauma and commonly mistaken for an abdominal aneurysm. In an aneurysm, there is high blood pressure, which results in the blood vessels dilating, and furthermore it can cause the blood vessels bursting. This condition is not usually problematic until it ruptures. Since aorta is the body's main blood channel, if ruptured, it can be life-threatening and complicated. Elastin fragmentation is the critical structural defect for the development of an aneurysm. Collagen deposition and degradation govern aneurysm enlargement. Rupture occurs when the wall tension exceeds the tensile strength of the collagen in the aortic wall. The risk of rupture is higher in large and fast-growing abdominal aortic aneurysm than in small and slow-growing abdominal aortic aneurysm. This condition mostly occurs in people aged 65 and older, especially male. Some other risk factors of abdominal aortic aneurysm includes atherosclerosis, smoking, hypertension, chronic obstructive pulmonary disease, and genetics. Let's talk about the symptoms of abdominal aortic aneurysm. When an abdominal aortic aneurysm is intact, there is abdominal pain, pulsating abdomen, whereas when an abdominal aortic aneurysm is ruptured, there is chronic abdominal pain, hypertension, tachycardia, syncope, and shock. How can you diagnose abdominal aortic aneurysm? Firstly, through physical examination. Feel for pulsatile, expansile mass in the abdomen. Secondly, medical imaging methods such as ultrasound, fluoroscopy, MRI, and CT scan. Let's talk about the treatment of abdominal aortic aneurysm. The treatment is aimed at preventing your condition from rupturing and may depend on the size of your condition and how fast it is growing. Therefore, surgery is recommended. Open abdominal surgery, where the damaged section of the aorta is removed with a synthetic tube sewn into the place or endovascular surgery, which is a less invasive procedure. Thank you for listening.